And welcome back once again to Texas Senator Bob Hall's Senate District 2 Facebook page, where we have been talking with doctors now for, since about the early part of 2020 on the issue of COVID and what's happened and changing our society and the events that have taken place that many of us could have never, ever imagined would even be possible to happen. Moving from an era in which hospitals and doctors were on the highest pedestal we had in our community for trust, belief, and acceptance of what they had to say and do, to a period today where we have thousands, if not hundreds of thousands of people who have died because that community failed us. The administration, and I'm not talking this, the doctors, there were doctors who participated in going along to get along and help contribute to the death of and excessive illness of many people. But the incredible lockstep fashion in which our hospitals and the doctors who were employed by those hospitals followed government edicts that they knew were wrong. They absolutely knew they were wrong, but the government put them out and hung carrots on them of extra money, financial incentives to follow their directives. And all of that was emanating from the pharmacy companies who saw the opportunity of COVID to make a whole lot of money. And they approached it, and it did not matter about the safety of the people or the efficacy of what they were doing. They were just determined that they were going to make a lot of money, and they got the government to follow along with them and ended up issuing some of the most insane rules and I guess undocumented rules that all of a sudden popped up, like you couldn't use drugs off-label, a practice that doctors, 60% of medicine, as I've been told by many doctors, is off-label use of drugs that works because the drugs aren't necessarily the ailment specific, but for what happens to either the lungs or the liver or kidney, whatever it is that has a similar symptom to it. And everybody's body is different. And so some drugs work with some people and some don't. And doctors, smart doctors, have recognized that they size up the situation and use what they think is going to be best, and have been free to do that until COVID came along. And all of a sudden, the government knew best without ever seeing a patient, without ever actually running any clinical studies on it. They issued edicts that said that ivermectin, hydroxychloroquine, budesonide, quercetin, all these other drugs that have been around and considered kind of miracle drugs for years with very, very low risk to them all over the world. And all of a sudden were chastised and told they couldn't use it, and hospitals refused to allow doctors to use them, and so on. And we ended up with those doctors who recognized, wait a minute, I was trained to understand my patient, to evaluate each patient individually, and then act based on what my training was for that patient, and not put everybody in a stovepipe and said that everybody who gets this particular disease, this is the only thing you can do for them. No. And all of a sudden, because those were out of step with what was coming out of what we know were gross lies being told by Anthony Fauci, the CDC, and the FDA, and were chastised by the hospitals, those that worked with them, and by our Texas Medical Board. Our Texas Medical Board went out of its way to try to force doctors to walk lockstep with whatever the government had to say. It just had to accept it. No rationale, no thought, independent thought behind it. Just do what the federal government said to do. But we had many a doctor that, thank goodness, we had doctors like we have with us today, Dr. Mary Bowden from Houston, and others like Dr. Peter McCullough, and others out there that truly stepped up and said, wait a minute, we know better. And some of them suffered greatly for it, cost them a lot of money. in their dealings. And Dr. Bowden was one of those who saw what needed to be done and said, you know, I'm a doctor. My job is to first to do no harm and to treat my patients the best way I know how, not how I'm being told to by a government agency. Now, I know there are certain rules to follow out there to make for the protection of people that are put out in the medical practice, but not when it comes to the individual decisions on treating patients. And so we've got Mary here with us today, who has been, I would say, pulled through an incredibly bad set of knotholes by both the hospitals and the Texas Medical Board. In particular, I'm a Houston Methodist and Houston Hughley are hospitals that seem to go out of their way. I mean, these are hospitals in which most of the patients who died of COVID in those hospitals died because of the hospital policies, not because they had the COVID. I mean, people got the COVID, they got sick, there's no question about that, but it wasn't the COVID that actually killed them. It was the hospital policies that used treatments that actually accelerated their death. And the doctors knew this. There were many doctors that recognized that what remdesivir was doing, recognized what ventilators did and how they used it and went about it in the isolation of the patients and so on, that all contributed to their death, not the COVID. And so we got Dr. Bowden here, and I appreciate you coming on to talk to us. I know you have been through an awful lot with the Texas Medical Board, and the hospitals seem to be going out of their way exceptionally strong to try to punish you for actually saving lives, to punish you for actually doing what was right. And as I've read through the stuff, I can imagine the imagination they use to make up the stuff that they try to say that you did that was wrong. Patients, which I think now that time has passed, you are actually extremely successful in treating COVID patients. I think that I read there was over 5,000 that you successfully treated. I don't think there's a hospital in Texas that could say they treated 5,000 patients that walked out of their hospital. I would be very surprised if there was any, or all of them collectively could identify having treated 5,000 patients that actually lived. So, but we could talk about some of that all day. I'd like to hear your story, Mary, and what you have gone through. I think the people of Texas would like to know also.
Well, thank you so much for having me. And I am extremely grateful to have you fighting for us, because there are very few politicians willing to do that. So I can't thank you enough. And I think what you said, the hospitals have gone out of their way to go after me. And it started with Houston Methodist Hospital. They were the first hospital in the country, the first business probably in the country, to mandate the vaccine for its employees. And that was in June of 2021. And at that point, I had been treating COVID patients for several months. I'm a ear, nose, and throat doctor, but I had so many patients coming to me saying that their primary care doctors would not treat them and they needed help. So I stepped up and I helped. I opened my clinic up to 7 days a week. I initially started giving ivermectin. I gave breathing treatments initially, and then I did monoclonal antibodies. The government started rationing monoclonal antibodies, and so I couldn't get them. And I still had a lot of sick people showing up, so I decided to give ivermectin a try. I researched it thoroughly before using it. I made sure it was safe. And then I started seeing that it was just as effective as the monoclonal antibodies. It didn't work quite as quickly, but I was able to keep people out of the hospital. And to date, I've kept over 5,500 people alive and well. And I can say that everybody that I treated with early treatment protocols is alive and well. So one thing I started seeing in that summer of 2021 is all the breakthrough cases. All these patients that were vaccinated were still getting sick, and they were just as sick, if not sicker, than the unvaccinated. So I started speaking out on Twitter. Shortly before they went after me, on one single day, I tweeted 25 times, "Vaccine mandates are wrong." and I put a patient testimonial on there. Well, they did not like that, of course, being the first hospital in the country to mandate the vaccine. I also, back then I was pretty conservative. I said things like ivermectin works. I wasn't too far out there. But they went after me and suspended my privileges. And the way I found out was through a reporter sending me a text message. A reporter from the Houston Chronicle asked me to confirm if it was true that my privileges had been suspended. And so I did a double take and I was like, no, what are you talking about? I have no idea what you're talking about. And then I checked my email. And then I went to Twitter and they were tweeting about it, that I was spreading dangerous information, harmful to the community. So as any normal person would do, I resigned because I didn't want to have anything to do with a hospital that would come after me in such a fashion, right? They didn't call me. There was no discussion. It was just bam, just throw me out. I had the media coming after me like crazy. Well, then because I resigned and they said I was under investigation, but they actually did not follow the procedures laid out in their own bylaws. So they said I was under investigation, but technically I wasn't. And if you're under investigation, you are not allowed to resign from a hospital. And if you do, they submit you to the medical board for review. So that's what I'm dealing with. I'm still dealing with that. And then the second case was Texas Hughley Hospital in Fort Worth. And this case, a lot of people know about it. And you were actually involved in this case. You testified as well. And it was a sheriff's deputy, father of 6, Jason Jones. He'd been in the hospital for a month. He had been in a coma for a month. They were discussing hospice. His wife had asked for ivermectin. Mr. Jones had asked for ivermectin prior to going into a coma, and the hospital refused. So she hired an attorney and she sued the hospital. And then she asked me to be the doctor on the other side. I testified on his behalf. I was one of the expert witnesses, and I was the one that submitted the prescription for the ivermectin. Well, we actually ended up winning the case, and we have a court order saying that they're supposed to grant me emergency temporary privileges. There are all sorts of things laid out in this order that protect me from the medical board coming after me. However, they've come after me anyway, and the hospital immediately appealed. And on appeal, there was a stay on the order, but the stay on the order did not take effect until after we went to the hospital to try to give the ivermectin. So we still had a court order on our side. But the nurse, when she showed up at the hospital to give the ivermectin, she was met by police. She was met by the hospital administrators, and they refused to let her give the ivermectin. Mr. Jones never was legally allowed to get the ivermectin. His wife did apply topical ivermectin to him daily, which I did not prescribe. And he actually did make it out of the hospital miraculously. Unfortunately, his recovery was just really rough. He lost so much weight, hundreds of pounds. He was just never able to quite get his strength back. And he did pass away in April of this year. But anyway, so those 2 hospitals came after me. They reported me to the medical board. We appeared at a private meeting. And
excuse me, just before you get in that, let me just kind of summarize what you just said about the hospital. You had to go to court. Now, here was a man that they were calling in hospice. They had said, okay, when you call in hospice, because you don't know it, you said, there's nothing left to be done here. We can give them palliative care to make them comfortable, but there's no more medical treatment for their problem. They're going to die. And so you're saying, wait a minute, there is another treatment here that we think you haven't tried, and he's about to die or going to die. Let us try this treatment. Maybe it will keep him from dying. But the hospital had rather see the patient die than let you use something that would have changed the way they treated patients. And that is the really sad, sick part about it. And the Texas Medical Board agrees that that's the right thing for the hospital to do. Let the patient die rather than have them receive treatment that might save their life if it's not consistent with what the federal government tells us.
Right. And they were released from all liability. It's all over the court order. if something happens from the ivermectin, the
Yeah.
hospital is not going to be in any kind of legal trouble.
Well, yeah, I know you had the added, okay, all liability is taken away. That wasn't even needed.
Right.
Texas hospitals and Texas doctors are essentially bulletproof for malpractice. The laws have been changed are such that doctors can mutilate patients and they're not responsible for it. There is almost nothing a doctor can do or a hospital that would be considered malpractice. So them arguing or hiding behind the liability of it was a farce. I mean, a
Well,
total
yeah.
farce.
And the immunity was given to all the hospitals and the physicians throughout the country during the pandemic. I mean, that's
Yes.
one of the big complaints everybody has, is we can't do anything because blanket immunity was passed to everybody during the pandemic.
Oh yes. Texas passed its own SB 6, and I think I was the only legislator that actually voted against that bill. But it made it even. It was another layer of protection. But anyway, go ahead. I just want people to understand that that's where our hospitals, like Methodist and Hughley, are. They had rather see a patient die than have someone treat them with something that was inconsistent with what their administrators said they were supposed to be doing.
Exactly. And right. So we met in an informal, they call it an informal settlement conference, where we try to work it out. And they basically propose that I pay $5,000 fine. I take 8 hours of continuing medical education, and then I retake the jurisprudence exam, which is a legal exam all physicians have to take in Texas, which I've already taken, as my my settlement offer. And I just said, no, I mean, I didn't do anything wrong. I was fighting for a patient's life. I would like to have everything out in the open, because the way the settlement conference works, they just give you anonymous experts who write their opinion. You have no way of challenging their opinions. You have no way of questioning them. You really don't have much of a defense. It's very much a kangaroo court. And what lays ahead may be a kangaroo court, but at least we can go into discovery. We can depose people. We can, bring some light into the whole process. And even if I walk away losing, at least we've got exposure going on.
And that's going to be in the administrative with the administrative folks, or is this still at the Texas Medical Board?
I believe it's administrative.
Okay.
Right.
Yeah, there's a real history about the Texas Medical Board and the administrative board. Several administrators in the past, but it will be very interesting to see how this one works out.
Right. Yeah. Well, I'm looking forward to getting some more information out there, because I have nothing to hide, but I bet they do.
No, I know you don't, and that's one of the reasons I was so anxious to do this, because I look at what you did as being as right and as innocent as a fresh driven snow out there of looking after the patient and doing battle with organizations that that are a modern day version of Germany in the 1940s. I mean, the crimes committed in the people that were killed by our hospitals and the doctors who refused to recognize that there were easy and effective treatments, inexpensive, readily available, that contributed to or led to the death of hundreds of thousands of people, far exceeds anything the Nazis did.
Right. And one point that should be made, the hospital argued that he's too far gone. It doesn't matter what we give him. It won't matter. Why are we giving him ivermectin? But there are actually 45 studies showing that when you give ivermectin after 2 weeks or later after the disease, patients like Mr. Jones, the outcome, 41% of those people survived. So it's, it's not 100, but it's still a lot better than what they were looking at.
But that argument is, okay, he's about to die.
Exactly.
What difference does it make if I wanted to do a dance around him and sing funny songs?
Right.
If he's going to die, what difference would it make if we made an effort to try to save him?
Right.
So
And the hospital, after we lost on appeal, they wrapped a towel around his feeding tube with towels and rubber bands, just so no one would sneak anything in there. I mean, they were
Oh,
just
wow.
evil.
They were determined that he was going to die.
Right, right. I'm
Well,
sure they were
I guess
disappointed.
that's probably tied in with the bonus payments they were getting for the treatment while he was there. So they had a financial incentive to make sure that he stayed in the hospital and died.
Right. And they also cited the FDA, at least in the court records, they cited the FDA as a reason that they could not give ivermectin, which I just came back from New Orleans, where we're suing the FDA over this issue, because they basically wrongly told the public that they should not take ivermectin for COVID, which that's not really their role. That's not their role whatsoever, is to act like, play doctor for patients. But that's another issue other than financial, is the FDA directing the public.
Yes, and good. I hope you're successful in that. So, okay, so go ahead, and what has happened since that time? Now, the hospital wouldn't let you; they let him out, but then he was so far gone, he just didn't, never did recover.
Right. He never recovered. And we had the informal settlement conference. Now I just wait until April and go along. And, it's a cloud of stress that's always on my mind. But there's really nothing I can do at this point until.
So what did the Texas Medical Board accuse you of having done that was wrong?
Well, yeah, they make it sound like I walked into the hospital and started writing orders on this patient's chart, which if I had done that, that would be a big deal. But
And
that
did
is
they
not.
put this in writing, or is this
Oh
just?
yeah, yeah. They said that I didn't examine the patient. Well, as we all know, telemedicine was, the predominant form of patient care during the pandemic, because doctors were too scared to examine patients. So everybody was using telemedicine, but no, apparently I wasn't allowed to. And they said I didn't get informed consent. Well, his legal proxy, his wife, who, I mean, this is all in the Texas Health Code, is allowed to give consent for her husband who is in a coma. They're saying I didn't get informed consent, I didn't examine the patient, that I tried to write orders on a patient without having privileges. Well, the hospital, the court order says that grant Dr. Bowden emergency temporary privileges. There's also something that came out of Medicare saying that doctors don't need privileges during the pandemic. You can go in because it's during a pandemic. We waive those requirements for privileges. So if they bothered to look at the court order, then none of this would be an issue, but they're ignoring the court order and making this as difficult as they can.
And an amazing thing is that the stories I have with other folks I've interviewed that husband or wife was in the hospital, or even themselves, and talk about having given the hospital orders in writing and verbally, no remdesivir. The hospital ignored that and did it anyhow. Told them no ventilator, because they finally figured out, knowing that 80 to 90% of the patients that were put on a ventilator were killed by the ventilator. And they didn't want that, but the hospitals did it anyhow. So going after you for not having informed consent, yet they ignored. The Texas Medical Board has done nothing to any of the doctors or hospitals that force patients to take remdesivir, or force them onto the ventilator, or told patients they could not leave the hospital, or and all the other. And the other thing was that you didn't examine. I had the stories of what people talked about having been in the hospital for weeks, and no doctor ever actually went in the room with them.
Exactly.
They would come to the door.
Right.
One would look through the window of a door, or would
Exactly.
stand at the door and then tell the nurse what to go do.
Exactly.
Or went in. And yet the Texas Medical Board ignored all of that and let them get away with that, what I just call shoddy medicine.
Yeah.
That was going on. The other side of that was what went with it was just inhumane treatment. I mean, we have other interviews of people whose bed linens were not changed, who couldn't get out of bed to use the bathroom and spent more than a week in that same bed. And it was multiple. It wasn't just one.
And I've reviewed charts for patients, after the fact, and one of the most consistent things I've seen is starving patients and not giving them IV fluids. So keeping them dry, like they have congestive heart failure, which makes no sense. So it's almost purposeful dehydration, and then not giving them any food, just starving them to death. You can't get healthy, you can't get better if you're in starvation mode. But this is what I've seen time and time again. And I mean, I know part of it is they're on a mask and they're breathing, but still there are ways around that, right? And it was just time and time again, very sad. I mean, I remember I saw a teenager that came in with just severe, he had COVID, but he had severe dehydration. He had rhabdomyolysis, where the muscle tissue breaks down. And the typical approach is just slam them with fluids. You give them liters of fluids, and they restricted his fluids. And this is somebody in Texas. You may have heard about this case. They restricted his fluids, and he died shortly after coming to the emergency room. But just because protocol called for restricting fluids during COVID, it's completely bizarre.
Yeah, that was everything the government came out with, and just about every one of the administrative procedures that I've heard from the hospitals made no sense at all. You stand back and look at it now, it looks like it was an orchestrated effort to kill as many people as possible, and do something that was as survivable as COVID was. I think the big mistake they made was that they thought that COVID was more deadly than what it was. And when it turned out to be not that deadly, they had to implement procedures that would force it to become more deadly.
And it's rigid thinking. I mean, I've learned a lot. I before the pandemic, I thought you can't treat viruses. I thought somebody that walked into my office with an oxygen saturation in the low 80s would need to be, stat intubation. But I learned that no, you can treat viruses. There's lots of things you can do to help a person who's suffering from a viral illness. And patients don't need to be intubated based on a number. You have to look at the whole clinical picture. And the other thing, this whole protocol-driven medicine actually started about 20 years ago. I remember towards the end of my training, they started implementing these checklists that you would have to fulfill to get paid by Medicare. So if a patient came into the hospital with pneumonia, you had to check off a certain number of things. And if you didn't do those things, Medicare wouldn't pay for it. So that has just become a growing trend. And then it just came to a head with the pandemic in the worst way possible.
Wow. It's I don't know how we turn around. I don't know how we get back to because I mean, we could talk all morning, and I know you've got patients to take care of and other things, but the changes that have taken place that I'm hearing from the doctors who are involved with education, that how our doctors are being taught today is dovetailing with this cookie cutter checklist approach that the government is trying to implement, that kind of came to us with Medicare. That's sad. That's a topic for another day. I would like to maybe talk about that, because and I don't know how we change that, but at least make people aware of it and out there. So, but is there anything else you'd like to tell us about this whole thing that you're going through?
Day by day, it's a slow grind, but I'm not giving up, and I will take this as far as it needs to go, because we need transparency, and I have nothing to hide whatsoever. So I can stand behind that, and no matter what happens, I know that I have done the right thing. So
good. I know you have, and that's good. And folks, you're listening to a doctor who actually treats patients based on what they need for the problem they have. And there are not many of those left out there. Mary's you're in Houston, right?
Right.
And I tell you, this is one doctor you can go to with your problem, and you can rest assured that she is going to address what you need to solve your problem. Because unlike the hospitals who put profit among well ahead of patient well-being, Mary is one of those that considers the patient's well-being is what she's there to do. So keep up the good work, keep up the fight. Let us know anything, whatever we can do to help you dealing with the government agencies. We work hard to try to get changes in our Texas Medical Board, which is doing more damage to people in Texas than any good. It needs a complete reform, restructuring with doctors who actually know what they're doing and care about the people, instead of doctors who made huge campaign donations to get a big title. We need to get away from that. And but anyway, thank you so much, Mary, and thank you folks for listening. God bless you. And Mary, you wanted to say one more thing?
Well, just thank you. Thank you so much for fighting for us.
I will. God bless you guys out there, and continue with the help you've been giving us by making sure that this video gets spread wide, and share it with all your friends, because the more people know about what our hospitals are actually doing, the better chance we have of public opinion changing them from being focused on their profits to being focused on the well-being of the patients that go there. And the same for the doctors who have lost their way. So God bless you, and God bless Texas.